and the holidays will be no exception, but we are grateful to the folks in our community who are taking steps to ensure COVID-19 won't have an opportunity to spread at their Thanksgiving celebration. We know there are creative and innovative processes that are being developed to make sure memories can still be created during this year. We also want to take this opportunity to encourage folks to make sure that they are following the recommendations passed last night by the Board of Health. These recommendations are centered around reducing your risk of getting COVID-19 and keeping those around you safe and healthy. These recommendations aren't necessarily new, but they do deserve repeating now more than ever. A few of them are as follows. Maintain at least 6 feet of physical distance around those not in one's household all the time. Avoid activities that require the removal of your cloth face covering if at least 6 feet of physical distancing can't be maintained. This includes eating and drinking with people not in your household. Eating with folks that aren't in your household is just very frankly a high risk activity. This is because you aren't wearing your mask and you likely won't be 6 feet apart when sitting at a table together. So that's why we are encouraging folks to only eat with members of their immediate household. Refrain from attending in-person meetings at work when 6 feet of physical distancing isn't possible. Instead, do virtual meetings when you can. Refrain from attending or minimize non-essential travel, and don't carpool with folks outside of your immediate household. And as always, practice good hygiene, including washing your hands and not touching your face. These recommendations are always important to follow, but they are even more critical now as we approach the holiday season, especially with the level of disease that we have in our community. We can change the trajectory of COVID-19 in our community, but it will take all of us working together and following all of those recommendations that are in place. We are testing today until 3 p.m. and tomorrow from 9 a.m. to 12 p.m. As a reminder, we will not be testing on Thursday or Friday due to the holiday, but please check our website or contact your provider as there are a lot of opportunities for testing throughout the community. As a note, our building will be closed to the public on Thursday and Friday, but our COVID-19 response will continue throughout the weekend though. And we'll now move into the local situation. We have 162 new confirmed cases since yesterday's report, giving us 17,243 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 948 probable cases. 15,913 of our cases are considered inactive, giving us 2,125 active cases. 571 individuals have been hospitalized at some point in their illness, and 106 Knox County residents are currently hospitalized. This is the highest number of hospitalizations related to COVID that we've seen for Knox County citizens to date. And sadly, we have one additional death to report today, raising our total to 153. And now I'll open it up for questions.
All right, please go ahead and submit your questions into that chat feature. Jeff from WATE, will benchmarks be posted this week?
Yes, they will still be posted this week.
Those will be posted tomorrow, Jeff. Daniel with WBIR, 106 people are currently hospitalized in Knox County. Can you speak to the significance of that, and how are you working with hospitals?
The hospitals are continuing to work every day and talk to each other every day to manage the increased census that they're seeing. But this is concerning, and I do want to remind everybody, we've talked about this a lot, but hospitalizations lag new cases. And so the hospitalizations we're seeing right now are from a couple of weeks ago, those cases that came from a couple of weeks ago. So we still are waiting on seeing what the burden will be in the hospitals from the spike that we've seen recently. And that's very concerning given that we're in the winter season when we typically always have increased hospitalizations, and really cannot stress the message enough that we need everybody in our community to participate in doing their part to prevent and slow the spread of this disease. And that's following the 5 core actions and all the recommendations that are out there.
From Vincent with the Sentinel, we have heard from people that they should expect to wait approximately 7 days for the results of local COVID-19 tests. Is that accurate? And what is the average result return time?
Last week it was 4 to 5 days. I haven't seen the benchmark data for this week. Vincent will have that out tomorrow, but it has been higher than what we want. So the average, again, I'm going to guess it's probably still close to 4 to 5 days. But our own testing, we were telling people to wait that long, and we still have some leftover lag from the previous week. But we switched to a new lab this week, and we are getting results back much quicker. And so hopefully our internal testing will decrease. But this is just, it's a volume and capacity issue for the entire lab process and all the logistics that go along with that. So the big message here is if you've gotten a test, we need you to isolate while you wait for those results. And that's been something that's been in place for a long time, but we really need to hit that home now so we don't risk continuing to spread the virus to our friends and our loved ones and our coworkers and everybody that we come in contact with.
Daniel at WBIR, we're hearing several area hospitals have patients in the hallways because there aren't enough rooms. Have you heard this? And is Knox County revisiting any plans to open additional buildings as makeshift hospitals?
That'd be a great question for the hospitals. They have all their search plans and they can address how they are handling the increased volumes of patients. And then they can also address the planning piece, but I can say that the message has always been that they want to do everything they can to handle the patients within the walls of the hospitals. And that's their current focus and what they will continue to work on, safer for the patients and their staff. And they're going to continue to work on doing that.
From Jeff with WATE, how is the contact tracing work going with the state supplied contractor now on board with KCHD? How many people are they providing, and is it enough to keep up with demand?
We don't have a set number of people assigned to us. The way that it works is we're allowed a number of cases that can go to the state. I believe it's 150 per day. Every region has, based on their volume of cases, has a number that the state will help participate in. So far, so good. It's still early, and we're keeping an eye on how it's working out for us. But I think also the point of all of this, and it ties into lab delays and contact tracing challenges, all of it is with the burden of disease that we have in the community. All of those things are more challenging. And so we really are relying on the personal responsibility of individuals who are getting tested to put themselves in isolation, especially if they're symptomatic or have been a contact to a case and they're worried about that. And then let their contacts know as well so they can make decisions on quarantine and getting themselves out of circulation in the community as well. We really, the more we get into this, the more we really need everyone's participation and taking some initiative themselves to make sure that they're helping to prevent the spread of the disease.
Vincent with the Sentinel, when you switch labs, is it a total switch, or are you farming tests out to multiple labs? Which labs are you currently working with?
It was a total switch, and we are currently using AEL beginning this week, and so far so good, but it just started yesterday. But again, we are seeing so far more rapid turnaround times, and the decision is always made on our ability to get test results back in a timely manner, and also the customer service piece, so that the clients that are getting tested have access to results and all of the things they need.
From Daniel at WBIR, there was a very long line outside KCHD yesterday for COVID-19 testing. How many people were tested yesterday, and how does that number compare to other testing dates?
Yesterday was by far one of our busiest days in recent memory. I don't have the exact number. We'll have to follow up with you and get that one to you. But I can say that I'm very proud of the team and the efficiency that they have in getting a lot of people tested each day. And so even as long as the lines were that you saw, I think the longest wait was 45 minutes to an hour, which is still, a wait. But if you would have seen the lines, you probably would have thought it would be longer than that. So they're doing their very best to process folks as quick as they can, and we'll continue to do that. And we'll get you the total number from yesterday later today.
From Vincent with the Sentinel, you just said that tests could take up to 7 days to return. Mm-hmm. With that kind of lag, can contact tracers meaningfully intercept potential cases, especially in light of the spike?
Again, we've been talking about this for a few weeks now. It makes it even more challenging. And that's why I'm really hitting hard on that personal piece and people staying away from folks if they're getting tested and they're worried about their risk. That they're removing themselves from circulation. It's more challenging. I can say that in general, in planning for pandemics, we would have expected that at some point the level of disease in the community does get too high for contact tracing to be as effective as we would like it to be, and have plans and have known that we would have to move to this kind of thought process for the community and encouraging them to isolate. But we also want to encourage the folks as they're doing this, just listen to their doctors that are also encouraging them to isolate if they're getting tested, the doctors who are testing them, and encourage the doctors to give out that guidance as well, so that folks can start doing things on their own, because it's getting more challenging for us. And then again, notifying your contacts as well.
From Jeff with WATE, will anything change from KCHD's end due to the updated bar and restaurant restrictions? Will you require more people to help with enforcement/education?
I don't think anything, we don't foresee anything to change on our end, and our team's well aware of the changes, and will continue to work with all of the partners involved as they have been.
From Daniel at WBIR, just to make the message clear, what do you say to people getting a COVID test before traveling or gathering before Thanksgiving?
Yeah, we're asking folks to isolate. If you don't have that test result back, and again, even if you have your test result back and it's negative, please consider the risk with the travel in general and coming into contact with folks. And again, we've been asking for a while now to consider having those smaller family focused Thanksgivings with your household as much as possible. But isolation is the big key there. If you don't have the test results back, please keep that in mind, that you just don't know, and you don't want to be the one to invite COVID to Thanksgiving dinner with the family. And so please be as cautious as possible when you're making your plans and acting on those over the next few days.
And it looks like, Vincent, your question was, a similar question was from Daniel just a few seconds ago. Let's see, anybody else have any questions? Please go ahead and submit them now. Also from Daniel with WBIR, what do you see as the consequence if people do not heed your warnings on Thanksgiving and have big meals with extended family all together?
I saw a really interesting quote yesterday, and I couldn't find it to go back and get to find out who it was from, but and Dr. Buchanan referenced it last night, I think, is that the more people that you put yourself around, that it's just every single one of those people is a potential exposure to you, and you are a potential exposure to them. And so there's exponential increase in risk there, especially when you look at what is happening in our community and what the disease burden is in our community. And so we really just want people to take that seriously and keep that in mind, and really think about how they can be creative and innovative in finding safer ways to celebrate this holiday. And I think we can frame it and have a mindset that we can form some really good memories that we've never had before. And we probably won't be doing Thanksgiving this way again. And it's something that we can maybe look back on and be like, hey, do you guys remember when we had Zoom Thanksgiving back in 2020, and laugh about that and form some good memories that go along with that. A little personal story I'll share is our family. It's just, our household that's getting together this year. And so we're having Thanksgiving pizza because my kids are really excited about not having to, eat all the Thanksgiving foods that they're not usually really excited about. And this is a really good year to do that. And so how can we frame the challenges that we're in right now in a way that is in a more positive light to help with the mental health of our community and our friends and our family, and still make some good and fun, positive memories during these challenging times. And I think that's really, really important. We still have a lot to be thankful for, and there's a lot of gratitude that we can have out there, and that we might just need to look at innovative ways in sharing that this year. I hope that answered the question. I'm sorry.
No,
went on a tangent.
From Bob Morgan with the Knoxville Liberty Press, can you please explain how the flu numbers are being impacted this year as compared to years past?
Flu numbers are gathered in a very different way. So every single COVID case and test, actually, for that matter, is required to be reported across the country right now. Whereas flu is not reported in the same way. It's a sentinel and a surveillance network that's there to see what is happening with influenza in the community. Deaths in pregnant women and children is what's actually reportable there. So basically, the flu reporting is a sample, whereas we have the actual hard data numbers for the COVID-19 patients that we're seeing. I'll say that it's very early right now still. Most years we're not seeing a ton of flu right now, and so we're still not seeing a ton of that. And we are hopeful that all the measures that are in place with the 5 core actions will also help keep flu down this year as well. We need that to happen, and we will be keeping an eye out for what we can see as we move forward.
And Daniel, to your previous question about how many folks got tested at the Knox County Health Department yesterday, I reached out to our director of nursing. It was 396. From Bob with the Knoxville Liberty Press, you opened the meeting stating there were recommendations made last night by the Board of Health. Aren't these mandates enforced by criminal penalties?
The ones that we actually referenced are actually recommendations. It was more of a resolution that we were referring to in the opening statement. All of those are they're not enforceable by criminal penalties in the same way of the other regulations that have been put forth.
From Daniel with WBIR, on Friday at the Board of Health meeting, someone mentioned getting 975 doses of the COVID vaccine by December. 2 questions. First, is that 975 individual shots or enough to immunize 975 people, since it may require 2 shots per person?
That is individual shots, and then the guidance is that we need to plan for the second dose for those folks with the next batch that comes in to get those second shots completed.
And then his second question was, is there a firm timeline on when those will arrive?
There is not a firm timeline. And with the news that came out earlier this week, I think it was yesterday, maybe the day before, the first vaccine is going through the process with the FDA as we speak. And we're hearing that I think the meeting is early in December, maybe the 10th or something like that. So from that point on, I expect things to move very quickly, but it has to get through that FDA final approval process that happens after that meeting is our understanding of when things will start rolling and be ready to go. But it will go very quickly is our understanding once that happens.
All right, any further questions, please go ahead and submit them now. From Bob Morgan with the Knoxville Liberty Press, what are the best ways to build your immune system to fight off any viruses? And why is there not any recommendations to vitamin regimens, exercise, or healthy eating?
That's a really good point. We've talked about that a lot, that we do encourage people to get rest and exercise and eat well and do all of the things that you can do to help protect yourself and to boost up your immune system. And we want people to continue to do that. So those are measures or recommendations that for public health, we have been pushing for years and years and years, and we will not stop doing that. All of these other things are just additional measures related to COVID-19 that we're recommending right now.
Also from Bob Morgan, why would the Board of Health want to shut down such facilities?
That's a great question for the Board of Health, and I believe the outcome of that wasn't shutting down any facilities from their meeting last night.
Also from Bob with the Knoxville Liberty Press, how much of the $7.2 million the Knox County Health Department received has been spent so far?
I don't have that number. We'll have to get back to you and get you how much we've spent so far.
All right, any further questions, please go ahead and submit them now. Right, from Daniel with WBIR, you said your family is doing pizza this year, but just for fun, what is your favorite traditional Thanksgiving dish?
I am a good Southern girl who grew up in Alabama, and I don't know if that has something to do with it, but I love cornbread dressing, and I'm saying dressing without the G on the end on purpose. So that's my favorite, and I'm going to actually still make myself a little dish of that as well. But my boys are very excited to make some homemade pizza, and we're going to make it as fun as we possibly can this year.
All right, any further questions, please go ahead and submit them now. From David with WBLT, where do you see the situation in 6 months?
Oh, goodness. If I only had the, magic ball. 6 months from now, I hope that we're vaccinating a whole lot of people and on our way to that light at the end of the tunnel that we've been talking about, we probably are still going to need to be following the 5 core actions at that point in time. But the more people that we can get vaccinated, continue to work on that, the better position we'll be as a community. And I hope that we are still working together and being kind and empathetic to each other and doing all the things that I know that make us proud Knox County folks and Tennessee people to get us to that point over the next 6 months.
From Brian Hornback, how long would it take to vaccinate a majority of Knox County?
That's a really complicated question. So, Brian, we have plans in place that we could get out. If we had all the vaccine here in hand, we could get vaccine into arms, for that matter, very quickly, within less than a week, typically, if we had it all. The challenge is that we're going to be reliant on this vaccine coming in and the allocations that we get and following the tiered system that's in place to get it. And so I can't give you a firm answer for that, given we don't know what that time frame will be that we have vaccine in hand to be able to do it. But I can tell you that our commitment is to get it out as quick as possible as we receive it within the prioritization that Tennessee Department of Health and CDC and others have set forth.
All right, from Bob Morgan with the Knoxville Liberty Press, what are your thoughts on the new Harvard study showing a majority of the workforce has been asymptomatic? Will there be any studies locally or actions taken to protect these workers or the general public?
Well, I think the 5 core actions are designed to protect those workers and the general public. We've been concerned about asymptomatic and pre-symptomatic folks for a long time. That's how this disease is so easy to spread. We have not seen the study, so I'd have to read it to speak more to that. And we don't have any plans for a local study right now, but we'll continue to look at the body of evidence and make recommendations as CDC and Tennessee Department of Health and other folks make them based on a whole body of evidence, typically not just one study.
Also from Bob with the Knoxville Liberty Press, is vaccination the only way to curb this virus within our community?
No, I think the 5 core actions and the decisions that individuals make have been demonstrated in lots of different places to be able to curb the spread of disease in the community. They're there to help mitigate that spread. And then vaccine is definitely one of the key players to help us get over the hurdle. And we can't emphasize that enough, but the 5 core actions really do play a huge role in this as well. And adherence and community buy-in to those 5 core actions are designed to help slow the spread and decrease the spread of disease. There's also treatment advances coming along, and hopefully that will help as well. So there's a lot of different things that are out there that can have impact.
All right, and I just got a message from our finance director to answer your question, Bob, from a few minutes ago. About $593,000 have been spent through October. Daniel, following up on the testing numbers, and yes, 396 people tested yesterday at the health department. All right, any further questions, please go ahead and submit them now. All right, not seeing any further questions come in, so thank you all for your time today. We hope you have a safe and healthy Thanksgiving weekend.